Hello everyone, welcome back. Now I'm going to start with a series of drug lectures about various important drug interactions in pharmacology, which are quite often asked in the exams. And you don't have to remember each and every drug interaction. There must be hundreds or thousands of reactions, which are not important for us to remember and humanly not possible for us to remember, right? But there are few interactions which are really important for us to know, especially for the students, and they're very high yield in your examinations. So I'm going to talk about in a few series of these video lectures about those important drug interactions. And in this way, you will also be revising certain concepts in pharmacology along the way, right? So this is Dr. Deepika Tikku from Simply Pharmacology. And before I begin, if you haven't yet subscribed to my channel, please hit the subscribe button. I keep coming up with new videos. And yes, all the important questions and all the important topics which I stumble upon, I try to put them in the videos, right? So let's get started with the must-know drug interactions in pharmacology. All right. Now the first one we have is levodopa with carbidopa. So before I begin with the interaction, what is important to know is what is the role of these two drugs? What are these two drugs? So levodopa is a drug which is used in Parkinsonism. And carbidopa is also used in Parkinsonism. So why do you need to remember their interactions? So whether they're given together or whether they're not given together, whether they should be given together or whether they should not be given together. So what to do? See, Parkinsonism mein problem actually kya hoti hai? There is decrease in the dopamine levels in the brain. Now, there is decrease in dopamine levels in the brain. So the best bet kya hogi hamare liye? That we directly give dopamine. But why do we not give dopamine directly? The reason being, this dopamine, it cannot cross your blood-brain barrier. Okay? So it cannot cross your blood-brain barrier. Nahi cross kar sakta brain mein. So what extra or what हम और क्या कर सकते हैं कि हम डोपामीन ब्रेन में बढ़ाएं. So we give some substance which can go into the brain and there it can get converted into dopamine. So see, that is the another best option with us. So levodopa does just that. So levodopa, it gets converted into dopamine with the help of an enzyme dopa decarboxylase. ठीक है? Simple है. It can get converted into dopamine and हमारा purpose solved रहता है in Parkinsonism. We can treat the patient. Now, the problem is that this dopa decarboxylase is present in the periphery and it is also present in the brain. So, when you are taking levodopa, patient ने गोली खाई levodopa की, what happens, in the body is that, like say this is your here, the GIT. Okay? So when the patient takes dopamine, this levodopa, so before it has to enter into the GIT, this levodopa ko mil jata hai dopa decarboxylase and this levodopa gets converted into dopamine in the periphery. Lot of dopamine is formed in the periphery. So let's say अगर आपने 100 milligrams का levodopa दिया है in the periphery, ये enzyme levodopa ko, let's say 80 milligrams of your levodopa, it gets converted into the dopamine. And what does this dopamine do? See, it cannot cross the blood-brain barrier, so it is of no use to the patient of Parkinson's. कोई फायदा नहीं है उसका. So ये इधर उधर घूमता रहेगा, इधर periphery में, it will go to the CTZ, it will cause nausea, vomiting, तो patient को side effects आने शुरू हो जाएंगे, it can cause cardiac problems and all those. So it will cause unnecessary therapeutic effects. And that is your side effects. So only 20% of now 80 milligrams निकल गया. अब सिर्फ 20 milligrams levodopa है जो blood brain barrier को cross करके आपके brain में जाता है और वहां पे ये levodopa L-dopa convert हो जाता है dopamine में. So 100 milligrams का drug आपने दिया but ultimately brain में पहुंचा 20 milligrams. So it's such a wastage of the drug. So what to do? So can there be a drug which inhibits this problem? Or which inhibits the conversion of levodopa in the periphery? So there comes to our rescue carbidopa. So carbidopa kya hai? Carbidopa is a peripheral decarboxylase inhibitor which means it inhibits this dopa decarboxylase only in the periphery. It does not inhibit in the brain. अगर brain में inhibit करेगा, then there is no use of this drug because levodopa cannot get converted into dopamine. So peripheral decarboxylase inhibitor है, so that means जो periphery में ये 80 milligrams levodopa was getting metabolized, now this won't get metabolized. So 100 में से 80 की बजाय let's say 20 milligrams drug waste हो गई. It can get wasted anyways. So at least now instead we have 80 milligrams entering your brain and that is converted into dopamine. So what happens with when you give this combination? It's a very, very good combination. Hardly today we give levodopa without carbidopa. It's available in combination. So it is a good combination. It's a good combination and we give levodopa along with carbidopa. And your advantages are that when we give this combination, you can decrease the dose of levodopa here because less of levodopa is getting wasted in the periphery. So you can decrease the dose of levodopa. So side effects also are going to be less in this particular person because of levodopa getting converted into dopamine in the periphery. So वो जितने भी peripheral side effects थे because of dopamine, they will be less. So it is a beneficial and a good combination to use. Right. Now, the second one is levodopa with pyridoxine. Now, what happens in this case? Now, pyridoxine, or you can say vitamin B6, if the patient is given levodopa, Parkinsonism का patient है, वो multivitamins भी ले रहा है, especially pyridoxine, तो क्या होगा? Now, जो ये vitamin B6 होता है, it is a cofactor for this dopa decarboxylase. Or you can say in the other words, it enhances the action, इसको stimulate करता है इसका action dopa decarboxylase का. So again this lower levodopa when it gets acted upon by dopa decarboxylate is going to get converted into dopamine in the periphery and side effects are going to occur. So it is decreasing the efficacy of levodopa because ज़्यादा metabolism करवाएगा in the periphery because vitamin B6 enhances the effect of dopa decarboxylase. So in this case you will have to increase the dose of levodopa. ठीक है, but this thing occurs only when you're giving levodopa alone. अगर अकेले levodopa दे रहे हैं तो ये प्रॉब्लम आती है. But because आजकल हम combination of L-dopa with carbidopa देते हैं, so carbidopa तो already इसको inhibit ही कर रहा है. So whether vitamin B6 increase करे, decrease करे, it doesn't pose that much of a problem. So in the combined case में, this interaction is not very significant. But if you're giving levodopa alone, then this interaction is significant. So अगर हम levodopa pyridoxine के साथ दे रहे हैं तो हमें levodopa की डोज बढ़ानी पड़ती है. See, whenever you're answering a question on drug interaction, you have to follow the 4 steps of answering this. First step should be, you should be able to explain what is drug number 1. Second, explain what is drug number 2. Third, you explain the interaction. And fourth, you derive a conclusion. ये चारों चीजें will complete your answer of a drug interaction. So drug 1 कौन सी है? जैसे इसमें levodopa है. Drug 2 कौन सी है? इसमें pyridoxine है. Interaction क्या है? Pyridoxine stimulates the dopa decarboxylase enzyme. Thus it causes enhanced conversion of levodopa in the periphery to dopamine. ठीक है, so it will decrease the efficacy of levodopa. Conclusion क्या है? That whenever a patient of Parkinsonism who is on levodopa alone is taking also pyridoxine, so you might have to either, if it is not necessary, agar multivitamins are not that important there, so you have to stop giving multivitamins. But usually if this occurs in an elderly age, elderly mostly patients are given some supplements and multivitamins वो ले रहे होते हैं. So the second option is you will have to increase the dose of levodopa. So this is your conclusion. So in university examinations जब ऐसे questions आते हैं, so they are very scoring questions. So this is how you answer. You explain drug 1, explain drug 2, then third is the interaction, fourth is the conclusion. And conclusion is very important because that will determine, examiner को पता लग जाता है कि you have understood the drug interaction. If you do not conclude, then this remains, then it's not an answer because you're not telling whether this drug interaction is good or bad. Right? Okay. let's go with the third drug interaction for the day, and that is alcohol with metronidazole. Now, another very, very important drug interaction. So if patient is on metronidazole, what is metronidazole? Metronidazole is a drug which is used in case of amoebiasis, and it is also used for anaerobic infections and giardiasis and so many cases, right? Alcohol is alcohol, we all know, right? So what happens if you are prescribing a patient or he has amoebiasis और उसको आपने metronidazole prescribe कर दिया है, and you forget to give a very important instruction to the patient that do not consume alcohol while you are taking this drug, or there can be a problem. आपने नहीं बताया patient को, patient is fond of having alcohol or patient has occasional alcohol, और वो किसी पार्टी पे गया और उसने alcohol ले लिया, और उसने casually he has gone out and taken alcohol. So what can happen now? See, the alcohol in the body, how it gets metabolized? It gets metabolized with the help of alcohol dehydrogenase. So it will give you aldehydes, acetaldehyde rather, acetaldehyde. Then with the help of aldehyde dehydrogenase, it will give you acetic acid, and this is now excreted from the body. Simple, right? Now, see, normally this process occurs in its own speed, and hardly there is any problem seen when patients on alcohol. Now, ये जो acetaldehyde है basically, ये जब बॉडी में इंक्रीज होएगा, इट लीड्स टू लॉट ऑफ अनप्लेजेंट साइंस एंड सिम्टम्स. पेशेंट हैज नोजिया, पेशेंट हैज वॉमिटिंग, पेशेंट विल हैव सम क्रैम्प्स इन द एब्डोमेन, पेशेंट विल फील गिडीनेस होता है, डिजीनेस होता है, चेस्ट कंजेशन लगती है. सो लॉट ऑफ सच प्रॉब्लम्स आकर विद द पेशेंट, राइट? बट थैंकफुली नॉर्मली जब हम अल्कोहल ले रहे होते हैं या कोई भी अल्कोहल लेता है, तो बिकॉज ये मेटाबलाइज होता है, बॉडी में एक्यूमुलेट नहीं होता, सो patients or these people do not see such problems. Now, when you are giving this metronidazole, what happening is this metronidazole is actually going to inhibit this particular enzyme aldehyde dehydrogenase. So when this enzyme aldehyde dehydrogenase is inhibited, the level of acetaldehyde in the body is going to go high. And as I said, when the levels of acetaldehyde in the body goes high, all those unpleasant symptoms, they start to occur in that patient. So, अब alcohol lovers जो होते हैं, the ones who like to drink and all, so they would not blame the alcohol for this problem. They would rather blame the drug कि हमने वो drug शुरू कर दिया इसलिए हमें वो problem हो गई है. So they might not start. They might stop taking the drug and leave the therapy in between. So, because of this, it is very important to tell the patient, when the patient comes to you and you are going to prescribe metronidazole, it is very important to tell the patient that, see, that when you are on this particular drug, do not consume alcohol because there are a lot of unpleasant side effects हो जाएंगे आपको इससे. So please do not consume it for at least 1 week, or maybe if it's on 14 days, in 14 days. And after the therapy, जब finish पे हो जाती है, still 3 days after the therapy, you are not supposed to take the drug, alcohol, because till metronidazole gets out of your body completely. So it is not allowed. Alcohol with metronidazole, the conclusion is they should not consume alcohol while on metronidazole for complete duration of therapy with metronidazole and even 3 days later. And what is this type of reaction called as? This reaction is called as disulfiram like reaction. और क्यों कहते हैं इसको disulfiram like reaction? Because disulfiram is the drug which is given to people who are alcoholics who really want to leave alcohol. ठीक है, हम ये उन पेशेंट्स में, जैसे अल्कोहल डी एडिक्शन के लिए पेशेंट्स आते हैं, वी ट्राई टू गिव अल्कोहल disulfiram to those patients because they are going to inhibit this enzyme and these unpleasant side effects are going to occur. So when a person is on disulfiram and he consumes alcohol, so he will have a lot of unpleasant side effects. So why would somebody want to have something which is causing such unpleasant side effects in the person? But इवन इन दोज पीपल जो अडिक्ट्स होते हैं, अल्कोहल एडिक्ट्स होते हैं, उनको भी हम बताते हैं कि अगर आपने डाइसल्फिराम थेरेपी के ड्यूरिंग कंज्यूम किया अल्कोहल, बिकॉज दे आर एडिक्ट्स, दे कैन नॉट लीव इट इन वन डे, right? So they will require some amount of days to get off alcohol. So if they consume alcohol during disulfiram treatment, they will get these problems, and this can be really very high intensity problems, very disturbing. So patient really has to be highly motivated to leave alcohol, कि चाहे कुछ भी हो जाए, मुझे कुछ भी प्रॉब्लम आ जाए, बट मैं अल्कोहल छोड़नी है. So अगर फर्स्ट टाइम उसने थोड़ी सी ले ली, उसको प्रॉब्लम आ गई, देन सेकेंड टाइम he probably will not take, or third time he probably will not take. But this needs to be clearly explained to the patient also. So this is actually the role of disulfiram in alcohol de-addiction. So जो भी drug अब aldehyde dehydrogenase को inhibit करती हैं and causes similar actions in the person because of accumulation of acetaldehyde, तो उसको नाम दे दिया गया है अब disulfiram like reaction. So they behave like disulfiram, right? This was the third interaction. And the fourth interaction that I'm going to discuss is again a very important drug interaction, monoamine oxidase inhibitors with tyramine containing foods. Very interesting interaction and must know interaction. So monoamine oxidase, short form इसको हम क्या कहते हैं? Yes, MAO. So monoamine oxidase, that means MAO, and MAO inhibitors we are talking about. Especially here we're talking about non-selective MAO inhibitors. ठीक है? So non-selective MAO inhibitors अगर patient, अब हम usually नहीं देते, we are giving selective drugs, but yes, non-selective MAO inhibitors, if you are giving to patient, and especially depression में जैसे है, antidepressants, they were previously given non-selective agents, but now we do not give non-selective agents. So either we give in anti-depression में जो MAO A inhibitors हैं, reversible MAO inhibitors like moclobamide, and Parkinsonism में MAO B inhibitors हैं like selagelin, हम वो वाले देते हैं. So MAO is of two types, MAO A and MAO B. ये दो हैं enzymes, and they are important, or the role is in oxidation or the metabolism of various amines like so 5-HT, एड्रेनलिन, नॉर एड्रेनलिन, डोपामीन, सबको मेटाबलाइज करते हैं. तो अगर ये इनहिबिट हो जाएंगे तो ये सारे लेवल्स हाई हो जाएंगे बॉडी में. सो इवन इन टायरामीन मेटाबॉलिज्म, ठीक है. सो दे आर प्रेजेंट इन द गट, दे आर प्रेजेंट इन द प्लेटलेट्स, दे आर प्रेजेंट इन द ब्रेन, सो दे आर प्रेजेंट इन लॉट ऑफ एरियाज. सो व्हाट इज हैपनिंग हियर इज पेशेंट हु इज ऑन मोनोमीन ऑक्सीडेज इनहिबिटर एज सच, तो क्या होता है, तो ये माओ एंजाइम इनहिबिट हो जाते हैं, तो वैसे ही जो इनकी मेटाबॉलिज्म है that is slowed down. ठीक है, so the levels would be higher of all these. Now, patients who are on MAO inhibitors and when they consume a diet which is rich in tyramine. Now, tyramine पहले होती क्या है? Let's do that. Now, tyramine is a drug which is an indirect sympathomimetic. क्या मतलब वो इनडायरेक्टली सिंपैथोमाइमेटिक होने का, कि ये आपका एड्रेनर्जिक नर्व टर्मिनल है, ठीक है, एंड ये आपका पोस्ट सिनेप्टिक टर्मिनल है. हियर यू हैव योर नॉर एड्रेनलिन इन द सिनेप्टिक वेसिकल्स, एंड हियर यू हैव योर अल्फा एंड बीटा रिसेप्टर्स. नाउ नॉर्मली व्हाट हैपन्स व्हेन द एक्शन स्टिमुलस अराइव्स, this noradrenaline will go out and it will interact with the alpha and beta receptors. Sorry, beta it does not act on. My apologies for this. Beta it does not act on, or adrenaline, beta 2 especially. I'm talking about beta 2 receptors. It doesn't act on. It mainly, let's talk about the alpha receptors here, because this is more important in this context. So noradrenaline means NA does not act on all the receptors. So beta 2 वगैरह पे ये act नहीं करता, alpha पे act करता है basically. और let's say आपका ये जो post synaptic area है, this is your blood vessel. So let's say इसको अगर मैं blood vessel की shape में draw करती हूँ, जो post synaptic है, this one. So let's say this is your blood vessel. ठीक है? So this is noradrenaline released, and here we have the receptor which is your blood vessel में कौन से होते हैं two main receptors, alpha 1 and the other is beta 2. So noradrenaline does not act on beta 2. So noradrenaline will act on this alpha 1, and what alpha 1 does, it causes vasoconstriction. That is the role of noradrenaline on the blood vessels. Now coming to tyramine. What is the role of tyramine here? Now tyramine is an indirectly acting sympathomimetic, which means it will first go into this adrenergic nerve ending. It will push noradrenaline out from here. It will come out here and then it will act on the alpha 1. So drugs which directly act on the receptors are called as directly acting sympathomimetics, and the agents which do not directly act on receptors but they will follow indirect path, वो धक्का देंगे नॉरएड्रेनालिन को कि भाई तू जाके अब काम कर. नॉरएड्रेनालिन तो खुद जाके काम कर सकता है, ठीक है, पर टायरामीन थोड़ा सा चालाक है. टायरामीन कहता है मैंने भी काम करवाना पर मैंने पिक्चर में नहीं आना, तो वो जाके नॉरएड्रेनालिन को धक्का देगा, नॉरएड्रेनालिन जाके फिर वही काम करेगा, ठीक है. सो दैट इज द वे द बॉसेस आर लाइक दैट, यू नो, दे विल मेक देयर वर्कर्स डू द वर्क. Noradrenaline is a worker, it is working, but tyramine is a boss and he say, I am not going to talk to that person, I am not going to talk to that customer, you go and talk to that customer. So he'll give a push to noradrenaline and noradrenaline will go and talk to the customer. And the customer here is like the alpha 1, and when it talks to the customer, what happens? There is vasoconstriction. Now, this is happening normally. Now, it is noradrenaline also gets metabolized then by monoamine oxidase and all, and tyramine is also getting metabolized by monoamine oxidase in normal situations. But now when the person is on MAO inhibitors, that means this enzyme is blocked, so there is no conversion. And patient consumes some specific food items. अब वो specific food items कौन से? Patient ने ले लिया कोई चीज़, खा ली, उसका मन किया, patient ने ले ली wine, patient ने ले लिया beer, some pickled meat. So ये जितने भी products patient ने खाए while he is on non-selective MAO inhibitors, they are very very rich in tyramine. Very very rich in tyramine. So when tyramine is present here, this tyramine is going to enter into the stomach, in the gut, GIT. Normally gut में भी monoamine oxidase present होता है, वो टायरामीन को मेटाबलाइज करता है. बट बिकॉज आपने ड्रग ली है मोनोमीन ऑक्सीडेज इनहिबिटर, तो ये एंजाइम हो गया ब्लॉक. सो टायरामीन एस्केप्स द मेटाबॉलिज्म, enhanced levels are there in the body, so it is going to do lot of stimulation, lot of noradrenaline is going to release, lot of noradrenaline is going to release, and when lot of noradrenaline is going to release, lot of stimulation of the alpha 1. Alpha 1 तो क्या, lot of stimulation of the alpha 1, and that means lot of vasoconstriction. Lot of vasoconstriction means hypertension, dangerous hypertension, hypertensive crisis. So it is so dangerous. So such patients, they will land in emergency. It's a hypertensive emergency, और इसकी ट्रीटमेंट हमें फटाफट करनी पड़ेगी by a drug which can be given. Emergency है, IV drug देंगे, IV drug like phentolamine, which is an alpha blocker, fast acting drug, because we have to block this receptor alpha 1. So interaction क्या हुई? मोनोअमीन ऑक्सीडेज इनहिबिटर्स जिन पेशेंट को मिल रहा होता है, अगेन उसमें डॉक्टर का फर्ज बनता है टू टेल द पर्सन that do not consume these food items because they are rich in tyramine and they can increase your blood pressure. So this combination is not advisable, right? So when somebody is on monoamine oxidase inhibitors, they should not consume the food items which are rich in tyramine, because tyramine will escape the degradation and it will going to push more of noradrenaline into the synaptic cleft. So more noradrenaline is now going to act on the alpha 1 receptors, more of vasoconstriction is going to occur, leading to dangerous hypertensive crisis. So this combination or this interaction is very important clinically. So therefore patients have to be instructed not to take tyramine rich food while on MAO inhibitors. So this should be your concluding statement, right? So with this we come to the end of today's lecture. So we have done in today's lecture 4 important drug interactions. One is levodopa with carbidopa, which is a good drug interaction. Levodopa pyridoxine, not a good drug interaction. Alcohol with metronidazole, not a good drug interaction. Monoamine oxidase tyramine, not a good drug interactions. So please remember these important points. You can go through this video once again to remember these important points. Take notes, and they are going to be really, really important because we try to revise certain important topics in pharmacology when we are doing these drug interactions. So in the next video, I'll be coming up with more such drug interactions that are important to know, and we'll be revising the other aspects of pharmacology in that video. So if you like my video again, please hit the like button, comment and subscribe. So I'll see you in the next video. Take care. God bless.